Dr. Rachel Kennedy from Highland Park Animal Hospital. I'm here today to talk about feline vaccinations, and my assistant Jess is going to help by asking some questions to better understand your cat's vaccinations.
Dr. Kennedy, what exactly are cat vaccinations?
Yeah, so your kitty will be vaccinated against several diseases, and this is basically a shot that's administered similar to human vaccines in order to expose the body to that antigen or that disease so that they mount an immune response against it. That way, next time that disease is encountered, your cat's body already kind of knows how to fight it off, and that can prevent that disease from actually occurring.
What cat vaccinations are typically recommended and what are they for?
Yeah, so there's two main core vaccinations for cats. This is the FERCP vaccine and feline rabies vaccine. There's also a feline leukemia virus vaccine that is kind of more lifestyle dependent. However, we always recommend getting at least a couple boosters of that as a kitten so that they have some immunity towards that. But these are all different viral and bacterial diseases that we like to prevent and can be pretty instrumental in your cat's preventative care. Sorry.
Can you tell me a little bit about the FIP vaccine?
The FIP vaccine is not currently recommended. We typically don't administer this because it is against a virus similar to the human strain, but a coronavirus. However, this is slightly different in that it affects the cat's GI tract. Typically, it causes only transient diarrhea. And there is a severe form of this disease, which comes when the virus mutates and creates a phenomenon called FIP, which can be either wet or dry form. The vaccination is not very efficient in preventing initial infection with the coronavirus, and then it does nothing about preventing mutation into these more severe forms. So we don't typically recommend this vaccination for those reasons.
What is the vaccination schedule for kittens?
Vaccine schedule for kittens is that they typically receive an FERCP vaccine and a feline leukemia vaccine at roughly 8 to 10 weeks. And then we booster both of those in roughly 3 to 4 weeks from that initial shot. Rabies is typically given once during the kitten series, typically after 12 weeks of age, and that one doesn't need to be boosted until the following year. So typically it's 2 visits as a kitten, and then we see them back in a year unless we do something like spaying or neutering around the 6-month mark.
What about adult and senior cats?
Yeah, adults we typically bump back to annual vaccinations, and then sometimes in very specific senior cases, if they're indoor only and have other concurrent diseases, occasionally it'll make a decision to skip a vaccine, but this is going to be at the discretion of your veterinarian and depending on your cat's health. Overall, we recommend doing vaccinations annually, and in Texas, rabies is required to be up to date, even in feline cats, and even if they're indoor only.
Are there risks and side effects associated with cat vaccinations?
So yes and no. There are occasionally vaccine reactions. These can be both short-term anaphylactic reactions. It's very uncommon. And then even more uncommon is the main hesitation that some people have, which is injection site sarcomas. However, vaccinations have been modified in that they are less and less likely to cause these injection site sarcomas, but it is a risk that's out there. But more importantly, the risk of your cat contracting the diseases that we vaccinate against, and that's kind of our main focus of vaccinations. While no drug is safe, we weigh our risks and our benefits, and we say the risk of your cat contracting some of these diseases is worse than the risk of a reaction.
Why is it so important to avoid missing a cat vaccination?
So yeah, you're putting your cat at risk for contracting these, especially kittens that have little immunity already. And then secondly, if your cat bites someone in the state of Texas, you can have to go through a mandatory quarantine period, and the county takes over, and it can be a whole ordeal. So we recommend that kitties stay up to date on vaccinations overall, and that we make sure that we're reporting any bites to the appropriate authorities.
If my cat is going to live strictly indoors, do they still need to be vaccinated?
Yes, definitely, both on the legal side and on the wellness side. There's always at risk that your cat could get out and be out for a day and spend some time with the neighborhood cats and expose themselves to a lot of different diseases that our vaccines prevent. So we always like to make sure they're protected, even if the plan is to keep them inside all the time. And then lastly, like we talked about, rabies vaccinations are state required, so that one is a little out of our hands. Well, thank you, and if you have any questions regarding your cat's vaccination, please feel free to give us a call. We're happy to help.